War demonstrators protest U.S. involvement in the Vietnam War in mass marches, rallies, and demonstrations.
It was a time of crisis and conflict. Millions of young people opposed to the Vietnam War rejected the values and ideas of mainstream America, arguing that love and peace could change the world. They set themselves apart from the rest of society through their dress, their music, and drugs. To the flower children, as they like to call themselves, drugs represented freedom, a chance to expand the mind and escape from the rules and demands of society. Drugs became such an integral part of the culture of the 60s that they were reflected in both the music and dress of the era. Long before the 60s, music has always been an accurate reflection of the sentiments of young people, and it remains so today. Consider how many gifted artists who wrote and performed today's popular music became victims of the very lyrics they created.
There are a lot of musical artworks and written artworks extolling the virtues of heroin. I think that it's glamorized, actually, in our literature and in our music. And so it's a real pull to get people into that subculture.
Death by drug overdose is not just a symptom of the psychedelic era, or of musicians, or of any particular group. It happens every day to people from all walks of life. Instead, they become statistics. They die a senseless and tragic death, leaving a trail of unanswered questions to plague the minds of families and friends. Why? What were they seeking? Why would they throw it all away? For what? For that temporary high? To defy authority? To help them deal with the pressures of modern life? Lifestyle, genetics, upbringing, environment, stress. They all can play a part in the development of an addiction. And it can happen to anyone. Athletes, politicians, corporate leaders. Just because they may not look like the stereotype of an addict does not lessen the painful and lifelong or life-shortening impact of their addiction. People suffering from an addiction often are unable to identify their own problem. Although the symptoms are usually quite evident, having either the strength or the ability to stop may be beyond their control.
The thing that I lost, besides time, while I was using drugs, was myself. I lost who I was. I lost any sense of self or any sense of self-worth, because when you're doing drugs, you can't feel good about yourself, because you wouldn't slowly be killing yourself or poisoning yourself if you felt good about yourself. So that's what I lost. As far as the material things, I had money at that time. I threw it away on drugs. I kept my house, my car, lost relationships, lost a lot of good friends, and that was sad.
For many, there is first the element of denial. They believe that they are in control and can stop at any time, that what they're doing is just a habit or recreational outlet. Addictive behavior also involves elements of habit, which can be defined as unconscious repetitive behavior. But a habit can usually be broken without too much discomfort. With addiction, however, the repetition occurs by compulsion, and considerable discomfort is experienced if the addictive behavior is not performed. With chemical addiction, even if the addict very much wants to end a relationship with drugs, once they have been introduced into the body, the chemical changes and electrical activity that occur in the brain may make quitting much harder than ever imaginable.
What we discovered was that, in fact, cocaine addiction, we used to say it's all in your head, thinking that meant it was a mental addiction. Well, it's in your head all right, but what we discovered is that it's a biochemical addiction having to do with brain chemistry. And it's actually a conditioned kind of response that occurs in the head, in your head, with brain chemistry as a result of using a pleasurable drug over and over again. So what happens is that chemical response gets triggered by all kinds of external and internal stimuli. And when the response occurs, you have a true physiologic addiction occurring.
The part of the brain that most drugs of abuse seem to affect has been called the brain reward system, outlined here in pink, red, blue, green, and yellow. These structures form the part of the brain which controls our feeling states and emotions. Drugs of abuse, unfortunately, have the unique capacity to directly affect the brain reward system, bypassing the normal channels of information processing.
If you're lying on the beach in the morning and the sun comes up and you're feeling really good, you've got this warmth covering your entire body, and you say, gee, I'd like to lie here all day long, but you know you've got a wife who says that you're supposed to wake her up in a half hour, you know you've got some kids who have got to be dressed to go to school, and you know you've got to go to work. Those things enter into your mind and moderate your behavior, and you pick yourself up, you get off the beach, and you go into your house and you take care of your activities. With a drug like cocaine, however, all those systems, or what we call gates, filters, are bypassed. The drug gets directly into the part of the brain that makes you feel just pleasure, and in effect takes control of your behavior, and you begin to lose contact with the necessities of life, as it were, the daily activities that you have to do in order to be a successful and productive human being in a human society.
Examining how drugs affect the functioning of the brain is to begin to understand the biological basis of addiction. Most people think of the brain as a single entity, but in point of fact, it is made up of millions of cells, individual elements of the brain that communicate with one another by means of electrical and chemical transmission. Typically, each cell communicates with adjacent cells through the release of a small amount of chemical called a neurotransmitter. Like tiny electrical flashes, millions of these transmissions occur every second. The neurotransmitters help impulses or messages travel and navigate through our nervous system, across synaptic gaps, from the body to the brain, and from one part of the brain to another. When people take drugs, particularly psychoactive drugs, it's this very transmission of impulses that is interrupted. All drugs affect the biochemical makeup of your body, which is why something as common as aspirin is able to reduce or eliminate the pain of a headache. Because drugs affect the body differently, government and health officials recognize the need to regulate their use. The Controlled Substances Act of 1970 created categories for both prescription and illegal substances that the federal government felt required strict regulation. The Drug Enforcement Agency was then formed to administer this new law, which divides drugs into 5 schedules or categories. Schedule 1 drugs have a high potential for abuse and addiction and have no accepted medical use. They include amphetamines, heroin, PCP, LSD, marijuana, and methaqualone. Schedule 2 drugs have a high potential for abuse and addiction with restricted medical use. Examples include cocaine, codeine, methadone, morphine, opium, and Seconal. Schedule 3 drugs have some potential for abuse and addiction with currently accepted medical use. They are butalbital combinations such as Fiorinal, Nalorphine, and Naludar. Schedule 4 drugs have low potential for abuse and addiction and currently accepted medical use. They are Thorazine, phenobarbital, and minor tranquilizers. Schedule 5 drugs have the lowest potential for abuse and are readily accepted for medical use. They include various over-the-counter preparations. Schedule 1 and Schedule 2 drugs include all the drugs that are illegal to grow, manufacture, sell, or distribute in the United States. The hundreds of Schedule 1 and 2 drugs can be divided into 5 categories. Risks surrounding the use of these drugs are compounded when they are administered by injection. In doing so, the user increases the chance of contracting HIV or hepatitis, or of developing skin infections, inflammation of the arteries, and infection of the lining of the heart. stimulants include cocaine, amphetamines, crack, crank, and ice. They are usually introduced into the bloodstream by either snorting through the nose, smoking, also called freebasing, or intravenous injection. These drugs affect the central nervous system and produce feelings of intense pleasure. Users may also experience increased energy, alertness, and heightened self-esteem. The long-term effects, however, far outweigh the short-lived euphoria. Depression, irritability from lack of sleep, and paranoia often result from repeated use. These drugs also place a tremendous strain on the body's circulatory system. Expectant mothers using stimulants pass the effects of the drugs to their unborn children, potentially exposing them to a life with damaged internal organs, physical deformities, and social and emotional limitations. Marijuana, a psychoactive stimulant, is usually smoked in the form of a cigarette. It is by far the most extensively used illicit drug. Users generally experience intensified reactions to outside stimuli. A normal laugh turns into intense giggling and silliness. Colors, sounds, and movement of things may become greatly magnified. The long-term effects of chronic marijuana use may result in lung damage similar to the damage produced from smoking tobacco. Other suspected risks include a suppressed immune system, blood pressure changes, and impaired memory function. Marijuana also impedes the ability to react and make quick decisions, creating a definite hazard for someone who is driving a motor vehicle under the influence. Like nicotine and alcohol, marijuana is considered a gateway drug, a drug that may lead to the use of other psychoactive and often illicit substances.
One of the reasons that pot is classified as a gateway drug is because it is illegal. And so you do have to start finding sources for getting an illegal drug if you're going to obtain pot. And very often those same people who distribute pot have access to harder drugs. So it does open the gate and make that a little bit easier from that point of view.
Despite the fact that marijuana is classified as a Schedule I substance, 34 states have passed legislation recognizing marijuana's medicinal value. Advocates stress that marijuana has potential therapeutic applications. With these therapeutic values in mind, it is argued that marijuana could bring relief for cancer patients undergoing chemotherapy treatment, AIDS patients who experience nausea from the disease and the drug therapy, glaucoma sufferers, and victims of multiple sclerosis, epilepsy, and chronic pain. In 1996, voters in Arizona and California overwhelmingly approved initiatives endorsing the legal use of marijuana under a doctor's supervision. Will other states follow suit? Do you think marijuana should be legalized?
Marijuana, in a way, I think should be legalized, but only under prescription, I think, because if it's just like handed out to people, you know, it's abused. I mean, not that it's not abused already, but, you know, I think it can lead to some positive health benefits.
I think that if you legalize it, it'll become too accessible to the kids that, I mean, when they're growing up, they'll think it's okay and maybe not realize the effects, the harmful effects that it does have. And, I mean, once you get addicted on it, it's really hard to stop.
I don't know about marijuana. That's a tough question. Well, if you legalize it, why not? People are going to do it anyway. So, yeah, maybe it should just be legalized because, I mean, people are going to smoke marijuana anyway.
I do think marijuana should be legalized. In other countries where marijuana is legalized, there's not as much crime. For example, in the Netherlands, it's legalized and there's not as much crime. True, the socioeconomic status and other things of our country, it might not react the same way if it was legalized, but I think marijuana should be used in health cases when it's necessary, and I think it would eliminate some of the crime.
How do you feel about legalizing marijuana? Just for medicinal purposes or completely? It's difficult to determine how future generations will handle this controversial issue. But as it stands today, fewer than 10 Americans are legally allowed to use marijuana for medicinal purposes. Opiates, the next category of controlled substances, are powerful central nervous system depressants that are known to relieve pain and to lower heart rate, respiration rate, and blood pressure. They include narcotics such as opium, morphine, codeine, and heroin. It is suggested that the physiology of the human body may actually encourage opiate addiction. Opiate-like substances called endorphins are naturally produced in the body and have multiple receptor sites. When attached to the receptor sites, these endorphins create feelings of painless well-being. Those same euphoric feelings occur with the use of drugs, such as heroin. The euphoric highs resulting from the illicit use of opiates, however, are often followed by depressive lows and accompanied by side effects such as weakness, dizziness, nausea, vomiting, decreased sex drive, visual disturbances, and lack of coordination. Recovering from a heroin addiction is very difficult and involves a long and painful withdrawal process.
I think that of all the drugs, being addicted to heroin, to opiates in general, but specifically to heroin, gets you into a whole subculture that you don't get into with other drugs. So I think that being addicted to heroin is one of the most difficult things to kick, if you will. And part of the reason for that isn't necessarily just the physiology of the drug itself. It's giving up the lifestyle that people get into when they're addicted to heroin.
The most common route of administration for heroin is mainlining, or intravenous injection. Psychedelics are popular drugs that distort the processing of sensory information in the brain, often causing hallucinations. They include LSD, mescaline, and psilocybin. These drugs are usually swallowed in the form of tiny pills, blotter-like paper, or gelatin squares. LSD is the fastest-growing illicit drug among the under 20 age group. Users are attracted to the altered feelings, perceptions, and thoughts produced by the drugs. Physical effects include increased heart rate, elevated blood pressure and temperature, goose flesh, increased flex speeds, muscle tremors and twitches, perspiration, increased salivation, chills, headaches, and mild nausea. Users of LSD often become depressed for 1 or 2 days following an LSD trip, and consequently turn to the drug again to relieve this depression. The resulting cycle often leads to psychological addiction. Deliriants produce delirium, or a mental state of confusion and disorientation. PCP is one of the best-known deliriants on the street today. It is often sprinkled into a marijuana cigarette, but the dosage is difficult to measure. Doses as small as 5 milligrams can produce dangerous and unpredictable effects, similar to depressants. Doses greater than 10 milligrams may result in a drastic drop in blood pressure, coma, muscular rigidity, violent and psychopathic outbursts, and possible convulsions and death. The long-term effects of PCP use are unknown. Designer drugs are illegal drugs which are manufactured by underground chemists to mimic the psychoactive effects of controlled drugs. At present, at least 3 types of these synthetic analogs are available on the illegal drug market: analogs of PCP, analogs of narcotic analgesics, and analogs of amphetamines and methamphetamines, which have hallucinogenic and stimulant properties. Ecstasy, a well-known analog that causes hallucinations and euphoria, was very popular on college campuses in the 1980s. In fact, it was dubbed the LSD of the 80s. The long-term risks of designer drugs vary, but many can result in numerous physical ailments, addiction, and overdose. Some young people who can't afford Schedule 1 and 2 drugs turn to vapor-producing chemicals known as inhalants. Legal to purchase and universally available, they include amyl nitrite, also known as poppers or rush, nitrous oxide or laughing gas, rubber cement, model glue, paint thinner, lighter fluid, varnish, wax, spot removers, and gasoline. Inhaling the vapors of these substances can cause hallucinations, as well as intoxication and euphoric effects. Although legal to purchase, inhalants are potentially very dangerous. Because they are inhaled, they enter the bloodstream very quickly. Since the substance is not diluted or buffered by stomach acids or other body fluids, they are hard to regulate and can be more potent than drugs which are swallowed. If the user's oxygen intake is reduced during the inhaling process, death can result within 5 minutes. Another drug with a high potential for abuse is anabolic steroids, currently classified as a Schedule III drug. Because of their use by both amateur and professional athletes, steroids have received extensive media attention. They are artificial forms of the male hormone testosterone, and they are generally used to promote muscle growth and strength. Usually obtained through black market sources, it is estimated that as many as 1 of every 5 athletes uses steroids. Besides the increase in bulk and power, steroids produce a state of euphoria and diminished fatigue. Adverse effects which occur in both men and women who use steroids include mood swings involving aggression and violence, known as roid rage, acne, liver tumors, elevated cholesterol levels, hypertension, kidney disease, and immune system disturbances. How prevalent is psychoactive drug use on your campus? Although many factors contribute to drug addiction, the biochemical factor is so powerful that its treatment is the topic of extensive research.
We know the treatment of drug abuse works. We also know that unfortunately it doesn't work as well or as often as we would like. Our hope is that by improving our knowledge of the biology of the brain, about what happens when people take drugs, that we'll be able to come up with better ways to intervene in the lives of drug abusers, both with medications and with better behavioral techniques.
Behavioral techniques often begin with abstinence from the addictive behavior, often initiated by the intervention by a significant other. Recovery treatment may also include individual, group, or family therapy, or perhaps a 12-step program which is practiced by support groups such as Narcotics Anonymous. But for some addictive personalities, behavior techniques are simply not enough.
The product of neuroscience is going to be better treatment, both of the verbal kind that we do currently, and also we're going to be developing new medications in the future based on neuroscience, which are going to help us weaken the craving or perhaps put it out of business altogether. So the treatment will be much more efficient than it is now, and many more people will get sober.
Sobriety is the goal for many people whose lives are controlled by drugs or alcohol.
What finally got me sober is my life wasn't working anymore. I mean, it wasn't a life. I would get up every day, go get drugs, use the drugs, be up all night, be paranoid, hear the birds in the morning and knew I had blown another evening, wait till I fell into a coma-type sleep, and I would wake up and do it again. So it wasn't really a life. It's almost like I was waiting to die. And one day I woke up and my brother actually came to see me, and I just started crying, and I said, I need help. I don't know how to be sober. And he said, we'll help you.
But the road to recovery is a lifelong commitment.
In our field, first of all, we try to never refer to anybody as being recovered. As soon as somebody thinks that they're recovered and they don't have to pay attention to this particular disease anymore, they're in danger. It's like having a heart condition. And as long as you stay on the diet that you're supposed to stay on, eat what you're supposed to eat, exercise the way that your doctor suggested that you exercise, and live a lifestyle that is going to result in you taking good care of yourself and your heart, you're all right. But if you stray outside of the bounds of the things that you need to do to take care of that condition, you're at risk. The same is true for an addict or an alcoholic for their life, as long as they pay attention to the way that they're living their lives and don't move into situations that for them are high-risk situations. They're okay. So they're encouraged. We always encourage people not to say, it's over and I'm recovered.
Would you recognize a drug problem in a friend or relative? If you did, would you know what to do? With all the information that is available about the harmful effects of drugs today, it's alarming to think that the use of certain illicit drugs is on the rise, especially among young people. One popular approach for teaching children to avoid drugs is to encourage them to just say no. But experts believe saying no is not enough. Educating people about the risks, knowing the risks, the symptoms and the alternatives to drugs is what can help young people make healthier and more informed choices.
I really encourage people to reach out and get education, not just about the drugs and alcohol and their effect, but about the recovery process and what they can expect in the recovery process, and to get the tools that we have available to people in order to help them through the recovery.
Besides education, other strategies for fighting the drug epidemic include drug testing at the work site, stricter border surveillance, and longer prison sentences for drug pushers. What about the alternatives to using drugs? What are some other ways to achieve an altered state of consciousness and help you cope with the stresses of everyday life? Exercise, music, support groups, or maybe just fighting for a cause can bring pleasure. Getting involved. When you have the benefit of knowledge, you have the confidence to overcome temptation and peer pressure. Although some of the alternatives to using drugs may be more time-consuming than, say, popping a pill, there are no side effects, and the rewards are much more enduring. What do you think might be the best strategies for fighting drug abuse?